Today I want to talk about the biggest myth about bipolar disorder that will not go away. There's certain mental health disorders where there's like myths attached to them, things that kids would tell each other in like the 90s. For example, I could make a whole video about schizophrenia and how having a split personality literally has nothing to do with schizophrenia. I have no idea why people believe that, and that's just like a thing that society believes. But let's turn our attention to bipolar disorder. So the great myth about bipolar disorder that is widely believed by the public and even a lot of doctors that aren't psychiatrists, the big myth is that bipolar disorder is characterized by sudden, intense, frequent mood swings. Okay, so listen to me carefully. Bipolar disorder has nothing to do with sudden mood swings. Okay, if someone is like normal 1 second and they flip out and they're super angry, and then 5 minutes later they're happy and giggling and euphoric, and then the next minute they want to end their life, that is not bipolar disorder. Okay, bipolar disorder is characterized by persistent shifts in mood that last days, weeks, or months at a time. Okay, bipolar patients get stuck in a major depressive episode or a manic or a hypomanic episode that just does its own thing and can last a long time if you don't intervene with medicine or doing something to help the manic person get 8 hours of sleep a night for a few days. Okay, so hypomania, for example, this has to be at least 4 days straight of these high-energy, euphoric episodes. It has to last 4 days to be considered a bipolar hypomanic episode. Okay, and a major depressive episode, when the mood is really low, needs to last at least 14 days. Okay, so bipolar, we're not talking about sudden shifts in mood where someone's flipping from high to low to angry to thinking about death to feeling giddy and impulsive, all within the space of a day. Nothing to do with bipolar. That's not to say that people with bipolar disorder can't have sudden shifts in mood. I mean, bipolar disorder can just make someone kind of irritable, but that is not unique to bipolar disorder. So what can cause these sudden outbursts, sudden shifts in mood? If it is a mental illness causing this, then in my experience, the most common cause is borderline personality disorder. Okay, people mix these two up all the time, and I've seen a lot of primary care doctors misdiagnose young women specifically with like type 2 bipolar disorder when they actually have borderline PD. Okay, borderline PD, one of its classic presentations are these sudden shifts in mood. Borderline people can go from normal to euphoric and happy and laughing to thinking about death and self-harm and wanting to end their life. Okay. The other common cause is going to be substance abuse, like substance intoxication, substance withdrawal. So substance use disorders can certainly cause sudden changes in mood. If someone is using methamphetamine or cocaine, of course, that can make someone go from whatever mood they're in to giddy and jittery and happy and excited. And then, during drug withdrawal, especially if they've been taking it for, months or years, and then they maybe run out of their drug of choice, then that can suddenly cause their mood to plummet and they become depressed and they think about death. So we've got borderline personality disorder as one of the most common causes of sudden shifts in mood. We've got substance abuse, and then another common one is PTSD. Okay, PTSD patients will they might look fine, and then there's some trigger. It might be, clearly visible and understood. It could be something that happens in the background that's picked up by their subconscious, and they can go from normal to hypervigilant, irritable, anxious, things like that. So to summarize, bipolar disorder is not characterized and has really nothing to do with sudden changes in mood, like what we call mood swings. Okay, bipolar is characterized by sustained shifts in mood that are either extremely positive or extremely negative, to put things simple. And these shifts in mood do not happen suddenly. They don't end abruptly, and they don't switch from one to the other in the same day. Okay, mania or hypomania lasts for days, weeks, or months without treatment. And the depression, the major depression that can come with bipolar, untreated, could last many months. Okay, I hope that was helpful. Good night.